Hello, I'm Dr. Said from Dr HE Clinic. Welcome to our new video series, and in this series we are going to review the operation technical details and main advantages and main disadvantages and main considerations in front of this blackboard like in ancient previous times. Today we are going to start with laparoscopic sleeve gastrectomy. As you know, this is a laparoscopic method, which means that we have small incisions. We will do the small incision, and by these incisions we will inflate the intra-abdominal cavity, and after that we will see your stomach properly and we will cut and resect your stomach. In laparoscopic sleeve gastrectomy, in our method, we will have 5 small incisions. The first one is on the right side. This is the biggest incision and it is 1.5 centimeter nearly, and we will cut and resect the stomach by this incision. And the center side incision is for camera trocar, for seeing the stomach, and the left side trocars are for laparoscopic instruments, and the upper side incision is for retraction of the liver. By using these trocars, we will see your stomach. When we start, we are going to place an orogastric tube. This is a guide for us, and after that we will cut and resect near the edge of the tube. So it means that the 80% of the total stomach is taken out, which includes the appetite zone, which secretes the appetite hormone. When we come to the main advantages of laparoscopic sleeve gastrectomy, as you see, there is only restriction of the stomach volume. So it means that there is a restriction of diet. There is no malabsorption or hypoabsorption like in bypass surgeries. In bypass surgeries, there is restriction plus connection between stomach and intestine or intestine to intestine. But in sleeve gastrectomy, there is no connection between any organ. So it means that this surgery is the most similar form to the original form of human body. It means it is so consistent with the human creation. This is a simple and straightforward operation for a bariatric surgeon. So it provides us a shorter procedure time. The net operation time is nearly 50 minutes, but with endoscopy and some anesthesia procedures, maximum 1.5 hours it takes. So shorter procedure time means that there's less exposure to anesthesia, so less risk of anesthesia, and it provides us fast recovery. After 2 days of the operation, you'll be discharged to the hotel. One of the main advantages is safer. This is safer for high-risk patients. What do I mean with high-risk patients? For example, patients who have cardiovascular disease or severe lung problems, severe neurologic problems like stroke. Severe risk patients have the less risk in the surgery because there is no connection, as I mentioned earlier. If you do the connections, if you do the anastomosis, which means that this is connection, there is a risk for anastomotic leakage or anastomotic bleeding. If there's no connection, the risk is reduced actually. Sleeve gastrectomy provides us a satisfying weight loss result. Satisfying means, for example, after 6 months, you're gonna lose your total weight in 25%. 25% total weight is lost. This is the expected numbers after the surgery. And after 12 months, nearly the 35% of the total weight is lost after the surgery. And these numbers is so consistent with our database. Of course, we expect the significant improvement of obesity-related diseases. Obesity-related diseases are diabetes, hypertension, obstructive sleep apnea, and asthma. And of course, some joint problems and mental disorders and fatty liver disease. There is significant improvement after improvement of obesity-related diseases. Of course, after satisfying weight loss, we will expect a decreasing in the back pain, shoulder pain, and joint problems. And we will expect a real improvement in mental disorders like anxiety. It is very related disorder with obesity. We expect an improvement quality of life. When we come to the main disadvantage, the first one is obviously weight regain. Actually, weight regain can be seen after the other procedures of bariatric surgery, but weight regain is a little bit higher than the other procedures in sleeve gastrectomy because this is just a restriction. There is no hypoabsorption. Of course, a little bit more weight loss is expected after bypass procedures. When we dive into the complications and side effects, the first one I want to tell you about that complications and side effects. You will be informed well just before the surgery. We will explain all the details about the main considerations. When we look at the complications, apparently the most frequent complication in the bariatric surgery is bleeding. Bleeding is the most frequent complication in the bariatric surgery, as in gastric sleeve, and it can be seen in 1% of the patients after sleeve gastrectomy. But when we see the bleeding, we will give anti-bleeding medications and blood suspensions. It can be manageable easily with that medications without any additional required surgery or intervention. So we are not afraid of this complication. They can be stopped by themselves easily. The second is the staple line leakage. It can be seen in one patient in 1,000 patients. When we look at our database, in last 6,000 patients, we see only 6 patients staple line leakage, and its therapy includes the endoscopic treatment models. Generally, there is no need for second surgery. The third one is blood clotting risk. Actually, this is so rare complication. It has lower risk than one patient in 1,000 patients. For example, in the last 6,000 patients, we see only 2 patients who have blood clotting problem. It means thrombosis. And for preventing the blood clotting for thrombosis, we always recommend putting on the socks. These are blood clotting socks, and we always give anti-blood clotting medication during the hospitalization process. So all these complications are manageable, as you can see. When we come to the main side effects, reflux. Obviously, this is a very specific complication for gastric sleeve. Actually, it's a natural process because we are gonna reduce the stomach volume, and gastric acid can come up and rise up to your mouth easily just after the surgery. And it can be seen in 20% of the patients. The new onset reflux symptoms after gastric sleeve is seen in 20% of the patients. The second main side effect, gallbladder stone formation can be seen after the surgery in 20% of the patients. But I want to admit that the other procedures like bypass have higher risk of gallbladder stone formation because it consists of the metabolic effects and some absorptive problems in the intestine. So the bypass patients have more gallbladder stone formation risk. This is not a specific risk for a gastric sleeve. And reflux symptoms can be manageable with stomach protector pills. I want to add this information. Only 1% of the reflux patients has requirement for additional surgery. Only 1%. At the end of this video, if we summarize all the information, let's consider the bariatric surgeries as steps. You can see the steps. The first step is obviously gastric sleeve. It provides us only restriction. And the second step is bypass procedure, which includes restriction plus hypoabsorption because there are connections, as I mentioned earlier. And the third step is revisional surgeries. It means that there is more and more restriction and more hypoabsorption. These are so complicated surgeries, and if you need the third step, you will be in the hands of more experienced bariatric surgeon. Actually, we can start with the gastric bypass. This is second step. If you have a severe long-term diabetes, if you have severe reflux symptoms, if you have any reason for need to do the gastric bypass, we can start with gastric bypass. But the first step is the least harmful for human body, and it consists lower risks than the others. The first step is gastric sleeve. If you have no any reason, no real reason to do the gastric bypass, we should start, and we recommend to start with gastric sleeve, which is first step of the bariatric surgeries. Of course, we will take a detailed history and we will listen to your expectations, of course, and we will discuss and we will decide together when we decide to the operation type. The indications of the obesity surgery is clear if your BMI, body mass index, is over 35, or if you have obesity related diseases like severe diabetes or long-term diabetes and you have BMI over 30, there is an indication for obesity surgery, bariatric surgery. And if you are eligible for these type of conditions, if you are eligible for bariatric surgery, we can start with gastric sleeve. In our opinion, we should start with the first step, gastric sleeve, if you have no reason to have the gastric bypass. Thank you very much. I tried to summarize the laparoscopic gastric sleeve's main considerations. Thanks for your patience. Thank you for listening to me. See you in the next videos.